Joining us this morning to talk more about it is our good friend, Dr. Matthew Knight, board-certified dermatologist. Great to have you. We always love when you come to visit us.
Great to be back. Thank you.
So this is a hot trend. Now, I know you're a dad of boys, so you're probably not seeing this as much in your house as I am in mine, but it is unbelievable the number of things these kids think they need for their skin.
100%. I mean, the global cosmeceutical industry is like $100 billion, and they predict it's going to double because of the reach of social media. And when it comes to parents versus TikTok, TikTok's going to win.
Yeah, every time.
And so you see these crazy trends, you know, kids at Sephora, millions and millions of viewers that have these skincare products and these whole regimens that they do that's really taking off. I mean, good luck buying one of these products around Christmas time. Everybody's sold out. But it's really the reach of social media. And we're seeing 8-year-olds applying retinol to their skin because of perceived wrinkles, or 10-year-olds using hydroxy acids on their skin. And what I worry about is kids comparing themselves to other kids and the bad effects of social media when it comes to bullying or body dysmorphic disorder. I think that we need to be very careful about that, but it's certainly taking off.
Yeah, man, that's the sort of the bigger issue, right? And
Absolutely.
And then the smaller issue is that they're kids, they don't need all of this stuff, right? What do you want parents to know? Because the parents sort of have to be the gatekeepers or the guardians who are like, okay, I'm not going to let you spend $100 of your Christmas money on all these products you don't need, right?
That's right.
Okay.
I mean, these products probably aren't going to hurt a young person's skin. I mean, maybe some irritation, but they're also not going to do much of anything. Most of these products don't absorb into the skin. Stuff that is absorbed into the skin is usually prescription.
Yeah.
So most of this stuff just sits there. Like it's like a tennis
ball. You want to show us? Okay.
So most of these molecules are huge, big molecules. Like let's take vitamin C, ascorbic acid, and you try to apply it on the skin. It doesn't get in. It just sits there. And then most of this stuff is like that. You just smear it on and it sits there.
Yeah.
And so it doesn't do any harm, but it also doesn't do any good. The other point is, there's nothing really new under the sun. These products have been around since the 1960s. They're just repackaged and they look nice. One kid's skincare company just sold for $1 billion. So they're doing huge business. But it's not going to hurt. It's not going to hurt, but it's also not going to help. But I really worry about body dysmorphic disorder. And if you look at social media use and depression and anxiety and even suicide, there's a direct correlation between young people using social media and comparing themselves to others online as early as 8 years old and the incidence of depression and anxiety. So I think as parents, we need to be much more concerned about that, about an 8-year-old comparing their wrinkles or perceived pigment spots online with another 10-year-old somewhere across the world.
So what do kids actually need, Dr. Knight? And I think, you know, I'm old school. I still remember the days where we used to take our makeup off with Noxzema. Do they even make that anymore?
I think they do.
Do they still make Noxzema?
It's nothing new.
Okay, so what do you actually recommend? Because you do take teens in your office. I know starting, I brought my 13-year-old in to see Dr. Knight. I know you take teenagers in there. What do you tell those teenagers? Because they do worry about things like pimples and acne and that kind of thing.
Yeah, when it comes to preteens, or a term I just learned, tweens, because I have one now, you know, being a kid should be simple. And skincare when you're a kid should be simple. And I know you're gonna know what I'm gonna say because I'm like a broken record, but sunscreen, right? Sunscreen in Florida is the one thing you can do to prevent pigment spots and wrinkles and skin cancer 20, 30 years later. That's super important, along with UV 400 glasses and hats and common sense stuff. Beyond that, in a mild cleanser, when you're a kid, that's all you need. When you get older, you get into your teens, when acne starts to become a reality, there are great over-the-counter products like adapalene, which used to be prescription, but it's an acne medication that can be used for mild acne. And if it's worse than that, quite frankly, if you have bad eczema or bad acne, you need to see a board-certified dermatologist because it gets more complicated than something you can buy at a store. But the take-home point, at least from my perspective, is this stuff is all fun and it's novel and it's an industry that's absolutely taking off. But as parents, and this really dials into what's going on in the Florida legislature right now, right? What is the effect of social media on kids, and how invested do we want our kids to be in a refrigerator full of skincare products and comparing themselves to someone else online? And what are the long-term effects? To me, that's the bigger issue here.
Yeah, absolutely. And getting back to what you need, a mild cleanser.
Mild cleanser.
And sunscreen.
And sunscreen.
That's it.
Being a kid should be easy, not more complicated than that.
My gosh, they already have so much going on, so
absolutely.
that's great advice. Dr. Matthew Knight, great to see you. Thank you as always, friend.
Thanks so much.
Love having you.